The U.S. healthcare system is broken. It's been broken for years and it continues to get worse. But the time is up and the time is now. It is up to us to reimagine and demand a better healthcare system for you, for me, and for our loved ones. Let me begin with a real story that exemplifies what it's like to go through our healthcare system. So let me introduce you to Becky. Becky lives in Santa Monica, California. She went to USC back in her college days, and now in her mid-50s uses her years of experience to run her own PR business. Becky's incredibly intelligent, she loves traveling and history. But one day last year, while she was starting her day like any other, she slipped when getting into the shower and broke her ankle. Now you can imagine the stress that ensued. An ambulance ride to the emergency room, getting discharged and having to find a surgeon and schedule an outpatient surgery, figuring out what post-surgical care would look like, not just from a medical standpoint, but Becky's gonna need help with things like getting her groceries and getting back into that dang shower one-footed with a cast. So now Becky is left on her own to navigate the complexities of getting the care she needs while figuring out what insurance will cover. And then the bills start rolling in. And here's the real kick in the gut. So recall, Becky runs her own business, so she doesn't have an employer that's subsidizing her monthly premiums and she's paying for private insurance. So Becky was already spending over $1,000 per month just to have health insurance. And then with her broken ankle, she had to pay her deductible and co-insurance and co-payments. And to add to all that, the insurance company wouldn't cover her home care expenses. So when all was said and done, Becky spent over $30,000 on healthcare last year. That is one expensive shower. And I wish that I could say that Becky's story is an anomaly, but it's not. The average family of 4 in the US with employer-based insurance now spends over $22,000 per year. That's like buying a brand new car every year. And you might think, oh, we spend so much money, we must have great health in return for the money spent. Absolutely not. We score last on health outcomes in comparison to every other high-income nation. We don't live as long as people in other countries. We don't get our preventive measures like cancer screenings and vaccines. And we have tons of people with unmanaged disease like diabetes and asthma. So now we're going broke over healthcare and we have terrible health outcomes, but surely you would hope that we have an incredible patient experience where the care is streamlined and easy to navigate. But unfortunately, the answer is no, as we saw from Becky's story. And when we look at things like the Net Promoter Score that ranks consumers' experience and level of loyalty, top brands like Amazon and Costco and Netflix have an NPS up in the 60s and 70s. The average NPS for health plans is in the teens. So now you're thinking, okay, Megan, what more depressing things can you tell me about our healthcare system? But one more, and this one's really important. Our clinicians are unhappy. The people who have dedicated their life's work to caring for sick people are so unhappy and so burnt out that they have the highest suicide rate out of any profession. Every single day in the US, a physician will end their life. The time is up and the time is now. We need to fundamentally shift the way we provide healthcare in this country. So what do we need to do to fix these problems? There's much to be done, but today I'm going to tell you 3 things that we must do. Number 1, we need to get everyone insured. Number 2, we need to change the way we pay our providers. And number 3, we need to change the way we provide care. So I'll start with number 1. We need to get everyone insured. Right now, about 27 million Americans are uninsured. That's about 8% of our population, which means about 1 out of every 12 people do not have health insurance. So what does this do to our cost of care? It skyrockets. And what does this mean for health outcomes? They plummet. So let me tell you another real-life story that exemplifies why this is the case. So there's a young man named Kevin, and he comes from a family that cannot afford health insurance and therefore goes uninsured. Now, Kevin comes down with a health issue that could have been taken care of in one day in an outpatient clinic. And if I had to put a price tag on it, I'd say it costs about $8,000, which isn't too much for an insurance company, but that's very expensive for an individual paying out of pocket. So now, due to this cost barrier, Kevin avoids going to the doctor for his issue, and where does he end up? He ends up in a hospital bed, and he is there for weeks before being discharged. So not only does Kevin not get the care that he needed, but we all paid 6 figures in expensive hospital care that could have been avoided. This is what happens when we don't have insurance coverage or we don't have good insurance coverage. Individuals avoid needed care and we all pay for it. Number 2, we need to change the way we pay our providers. Right now, health systems get paid to get you through the door and to do more. And this isn't their fault. This is the structure by which we pay them. They get paid to physically see you in clinic, to do the surgery, to scope you, to do more chemo, to do the C-section. They do not get paid to take the healthier, less invasive route. And because of this, we see increased spending, but we do not see the benefit of good health outcomes. So imagine the difference we would see if health systems were paid based on the outcomes of your care. What if they were financially rewarded for keeping you mentally and physically healthy in your home so you don't even have to step foot into their clinics and hospitals? Imagine how this would drive down your costs while giving you better care. These financial incentives like capitation and value-based payments do exist, but any healthcare administrator will tell you they are not wide enough or strong enough to actually push providers to embrace this shift and actually change the way they provide your care. Which brings me to number 3. We need to change the way we provide care in this country. Once we have the proper financial incentives in place, healthcare delivery will completely shift to focus on you, the consumer, and your needs through what I like to call the digital care journey. The digital care journey describes how you will navigate and receive high-quality healthcare with the use of technology. It is a funnel of layers that starts with inexpensive tools at the top that reach the masses and works their way down to more expensive and individualized care. The first layer in your care is asynchronous video. Right now, the only way you receive information to manage your care and navigate the system is either verbally or on paper. But there is so much information that we can crowdsource from top healthcare experts and convey to you throughout your care journey using recorded video. Then you can watch the videos at your own pace and place, you can rewatch them with loved ones, you can watch them in your first language. You'll be able to better retain the information through audio-visual learning. The videos also serve as an extension of your care team and take the work off their plate so they don't have to have redundant conversations, or maybe they aren't even having the conversation because they just don't have the time. There are so many benefits to using recorded video that will improve your experience and your health outcomes, and it will be the first layer of your care. The second layer in the digital care journey is live video. Oftentimes, you need to speak with your clinician in real time, but you don't need to be seen in person. Telehealth, which is essentially a FaceTime or Skype with your clinician, allows you to get the care you need from wherever you are. The third layer is care in the home, where someone from your care team comes to your door just like Amazon. There is so much care that we can provide from the comfort of your own home with everything from blood tests to wound care to checking the floors to make sure you won't trip and fall. So now we have recorded video, live video, care in the home, and then we go into the clinics and outpatient centers. And only when we have a true emergency or need a higher level of care do we actually end up in a hospital. But now, in the digital care journey, when you do have a stay in the hospital, you have recorded and live video to support you during and after your stay. So I know that we've talked through a lot and you're probably thinking, but what can I possibly do to fix this broken system? But there is one thing that you can and you must do. You must demand better. Do not accept the status quo. This is life or death. As a consumer, you deserve high-quality, affordable healthcare, and you must demand the 3 things that we've discussed from your politicians, your payers, and your providers. And if you work in healthcare, whether you are in administration or you are on the ground providing care, you play a vital role. It is up to you to create this new system of care. Keep fighting for what is right. Hold yourself and those around you accountable. These are our mothers and brothers and children and neighbors. They are going through cancer and kidney failure and heart attacks and pregnancies. They are stressed and confused and spending way too much of their hard-earned money on healthcare. So I'll say this again. The time is up and the time is now to fundamentally shift the way we provide healthcare in this country so that we can have the best health at an affordable price. that creates a better experience for everyone involved. Thank you.